So, hi, we're chatting today all about cancer and sharing our personal stories of breast cancer because we both feel that it's so important that we have conversations about cancer, that we raise awareness about cancer, um, and yeah, just share personal experiences of it. So, my name's Julie, and I write an emotional wellbeing newsletter on Substack. And after many years of struggling with depression and anxiety, I decided that I wanted to learn more about mental health. So, I went on to uni, did a degree, and literally just weeks before graduation, I was diagnosed with invasive lobular breast cancer. Um, so I really feel that my degree has enabled me to process my diagnosis, to acknowledge it and to move through it. But a big part of that journey was actually getting in touch with Leanne. So Leanne reached out to me after she heard about my diagnosis through a friend of a friend, and it's made a world of difference just to have that connection with somebody who knows what it's like to be in this position. So I'll let you quickly introduce yourself, Leanne, give us a little bit of background about your story.
Yeah, so I'm Leanne. And yeah, so we shared that story regarding receiving a cancer diagnosis. So for me, it was back in 2022. Um, it was not really paying attention to my body until all of a sudden I got a bit of a sensation, a bit like electricity. And yeah, I got the triple positive hormone cancer. It was invasive, so I needed a mastectomy, chemo, radiotherapy, hormone therapy, which I'm still on at the moment for the next 10 years or so, I think. And yeah, I heard about Julie and I felt, a connection regarding, family life, being a mum, how to navigate all of that, and just to, cherry on the top, a cancer diagnosis. And I thought, now wouldn't it be good if we, got our heads together and supported one another going through this? And it's just been bliss ever since.
Yeah. And it's really interesting because I think we share so many similarities in terms of our diagnosis and our journey. And, we're a similar
Mm,
age. We've both got children.
mm,
We've both got invasive or had invasive lobular breast cancer, which means that the cancer's actually spread to the surrounding tissue. Um, but for me, I actually found a lump, which is why I went to get checked. So did you feel more of a sensation rather than a lump?
yeah, so I had the sensation first, and because it kept coming back, I kind of thought, oh, what's that? And then I went to feel. Um, and at the time, I wasn't a fan of looking at my body.
Mm.
That's, maybe a chat for another day. But then I noticed, I stood in the mirror and I had I think I went on YouTube or something to have a look at how you could feel for breast lumps. And I noticed that my nipple was actually inverted. So with that, having a feel and the weird sensation, it was like electric shock tingling. I thought, yeah, I need to go and see my doctor. And it was very quick. I'm actually living in France at the moment. And I know there's a different protocol for the UK for from the point of the GP referral to getting a diagnosis or more information. It was just felt very, very quick, from that point of, GP referral to consultant to mammogram to diagnosis. Yeah, it was a real whirlwind for
Yeah,
me and the family.
yeah,
Yeah.
yeah. Similarly, it felt quite quick for me. I think from the day of going to see the doctor and getting examined to being referred to the breast unit, was a
Mm.
week. And having tests done, and then it was just another week before I was getting diagnosis. So from being seen at the doctor to getting my diagnosis, it was only 2 weeks. It was really fast, which is quite
That's
crucial.
good.
Yeah,
Yeah.
but I think it's really important to just mention that, like, I love your self-awareness that you were aware of this sensation and you didn't just ignore it and you thought, actually, there's something there
Mm,
and it keeps coming back and you went further with it,
mm.
which is brilliant. Because it's not always a lump. People
No,
don't always
exactly.
find a lump, do they?
Mm,
It can show in so many different ways, like you were saying, nipple inversion. Sometimes
mm.
like a nipple discharge, or there's a
Yeah.
different texture to the skin, or
Puckering, I think they call it, don't they? It looks a little
puckering.
bit like a orange skin,
Yeah,
orange peel or
yeah,
something, I think. Yeah.
yeah, it does. So it's not always a lump, but it's just about being aware, isn't it?
Mm.
Just checking.
Yeah, it's all about knowing you're normal. If
Mm,
you, and this is the thing about, why I say it's another conversation for another day, but getting familiar with your body, I think is a really good thing, to be
mm,
aware of what's your normal. Like maybe you have got different shaped nipples and maybe they do go in a little bit, and I think that's pretty normal for some
yeah.
people. But if you know that they only go in a little bit and they go in a little bit more,
Mm,
you know your difference. And it's to know your body, know the feelings, it's paying attention. Your
yeah.
body, I'm almost quoting a book already.
Mm,
There's a book called The Body Keeps a Score, and they're talking about, you know, that impact of what happens in your body and,
yeah.
going forward.
Yeah. Yeah. Just noticing changes and when something's different is
Yeah,
really key,
exactly,
isn't it?
exactly.
And I think one
Yeah.
thing for me, like, I mean, it shocked me when I went for my checks to see, in the waiting room that it's now predicted that 1 in 2 people will get cancer in their lifetimes. And I remember
Mm,
when it was 1 in 6. So it is
yeah,
increasing. But also, like, the research and treatment are also increasing. And
yeah,
I think,
definitely.
years ago, cancer is something that wasn't talked about, or everyone was too scared to talk about it. And for
Mm,
me, I'm so passionate about having conversations about it, talking boobs, nipples, and
yeah,
just
it's
having
great.
great conversations because we need to be able to talk about it and we need to
Yeah,
help raise awareness so that other people can feel comfortable talking about it and check in and then
yeah,
that is key, isn't it? It's just
yeah.
having that awareness and being able to check and talk about it because that at the end of the day is what's going to save lives. It's going to help people to get early diagnosis.
Mm.
Um,
I think it's changing, isn't it, as well, because of the awareness work that, certain charities are doing and having that research out there to back it up. The fact that we now understand, people used to think that breast cancer was just something for older ladies,
mm,
so now we know that it does affect men. It
yeah,
does affect, women of a younger age.
yeah,
And having those charities like Copperfield and Breast Cancer Now, um, to name a few, I think it's crucial. And also to stop that taboo of, being so conscious
yeah,
about your bodies,
yeah.
which is, it is uncomfortable. Some people are more private with that kind of thing, but it's important that you have to get, be comfortable with the uncomfortable, to know that, you notice your changes and you have the conversations. It's not taboo anymore.
Mm,
And there's young women out there who are talking about it more, I think, because of that change, which is also helping the older population.
mm,
I've got my grandma who has been through it in her 60s, and having conversations with her, I think it's helping, and the older generation to actually see that transition really to
yeah.
how it can be an easy conversation to have.
Yeah, yeah. You talked about a couple of charities there as well. Um,
Yeah.
Copperfield, I think, are amazing for raising that awareness, especially in younger people, because
Yes.
people don't realize actually, younger people can get breast cancer. Some people in their 20s experience breast cancer.
Mm,
And although it's
mm,
only sort of like half to 1% of the population of people that are diagnosed with breast cancer is men, it's a very small proportion. A lot
mm,
of people aren't aware actually that men can get it as well.
mm.
Um, and
Yeah.
Copperfield as well, the one thing I love about them is they do video tutorials, don't they? They've got loads of information. and
Yeah.
and also you can get monthly reminders, can't you, just to to have a check,
Yeah.
look and feel once a month.
Yeah,
which again is brilliant.
it's so good. Yeah, they
Mm.
do a lot of work out there, and it's impactful. It's actually
Yeah.
having an impact. I've had two conversations when I've been fundraising for Copperfield, with specifically with people actually saying, I didn't actually know how to do a breast check,
Mm.
and it was a young girl, and so we actually spoke about it. And then recently, actually, I spoke to a lady who was so scared. I think she, late 40s, talking to her. She'd put off a mammogram for over a year. And long story short, I managed to support her through that. She found stage one, and, she's had a lumpectomy. She's recovering well from surgery. And it's just, again, like you said, it's all about conversation. It's about
Yeah.
talking, it's about awareness, and whether it's a charity or it's us, chatting on a video like this, sharing posts, leaflets,
Mm.
just keep sending that message out there.
Yeah.
That's what it's
Yeah.
about.
Yeah, and I've actually covered in one of my posts actually I did talk about mammograms because I think there's
Mm,
almost a bit of a fear in some people of going for a mammogram because they're scared of what to expect. They don't know what it's going to be like.
yeah.
And everyone's going to have different experiences. But yeah, I shared
Mm,
my experience of it. I've had two mammograms now, um,
mm,
and I don't find it frightening or scary or nerve-wracking
no,
at all. And it's so quick. It takes like literally a few minutes, doesn't it?
yeah. Yeah, exactly. It's
One
just the fear of
thing
the unknown, isn't it? It's
it
just
is,
that.
yeah. If you don't know
Yeah.
what to expect, you almost sort of avoid it, don't you? But it can be so
Yeah.
crucial and life-saving actually just to go for a mammogram, can't it?
Yeah.
Mm.
Absolutely. Yeah.
The one thing that really struck me when I was diagnosed is that there are so many different types of breast cancer and
Mm,
different factors that affect it, it was so surprising to me actually because I thought breast cancer was just breast cancer. I think
mm,
we share quite a lot of similarities in our
mm,
types of breast cancer, but there's also a few differences there as well.
mm.
So we were both saying we've both had the invasive kind of breast cancer where it spreads from the nodes and out to the surrounding tissue.
Yeah.
But there's also hormones are a big aspect, aren't they, of different
Yeah.
types of cancer. So they check for estrogen and progesterone receptors in breast cancer, so you can be positive or negative to those. And then
Mm,
a growth receptor called HER2,
yeah.
which is a bit mind-boggling to me. It's taken me a while to get my head around that one. Um,
Yeah, that sounds good.
you can
Yeah.
have positive or negative with all of those, can't you? Um,
Yeah.
which I didn't realize. And mine, so I've got estrogen and progesterone positive, but HER2 negative.
Oh, I didn't know that. Okay.
Yeah. So so it's really key to see actually that each person that gets a diagnosis, they're going to have a very sort of unique diagnosis and unique treatment
Mm,
plan because it depends on all these different types of factors, where it is, if it's hormone receptive, um,
mm,
and they can check for levels of aggression and they can like tell you
mm.
what stage it is. So there's so many factors to go into it, isn't there?
Yeah. Yeah.
Which
Definitely.
I think is really key because sometimes you'll, be talking to someone or hear of somebody having breast cancer. And I used to think everyone with breast cancer is all in one group, like just one sort of
Yeah.
part of this is a diagnosis. Whereas now I'm thinking, oh, I wonder what kind, I wonder, where it
Mm,
is or if
mm,
it's hormone receptive and all of that. But it fascinates me actually how much they've learned about cancer and especially breast cancer because it's so um, prevalent, um, and also how they can adapt different treatments to it. And I know again
mm.
we're on very similar um,
Yeah.
treatment
Yeah, that's interesting. That is
courses.
thinking that if we have got a different if you're hormone positive with the HER negative, we have had the same treatment protocol more or less. I think it's the same, right?
Yeah.
With the hormone treatment after and stuff.
Yeah.
Um, yeah, it just kind of reminds you of how unique and personal it is. Like it's, not all one size fits all kind of approach, even though we're in that same boat as having breast cancer, but treatment plan and exactly where and how big and has it gone to the lymph nodes or not? That's another element of treatment. Is it so
Mm,
many lymph nodes that are positive or negative? I mean, there's a lot of information.
there is.
And yeah, I think I remember for me, it took me quite some time to get my head around what it all meant. And I definitely remember I couldn't even get my head around it. I had to have my husband take the paper and Google carefully what it meant. The diagnosis, officially came on, it was on a piece of paper, it was handed to me. And I was just too, blocked, I was too overwhelmed. So he had to kind of repeat and break it down for me because I just couldn't understand it. Now I get it a little bit more. Um, but yeah, it's a very personal diagnosis, more than I think I realized too.
Yeah. It is, and it's so hard to actually take that information in, isn't it? There's so much information that's
Yeah.
given to you, and it does take
Mm,
time, and it's really hard, but you do need to give yourself that time and space to be able to process it. And,
mm,
for us, I mean, me and Steve had to actually process it ourselves before we could share it with other people because we had to get our own heads around it and understand it before we could
yeah.
start telling other people and almost
Mm,
managing other people's reactions and confusion and questioning about it as well.
mm, mm,
Yeah. And yeah, in terms of treatment, we've both had surgery, we've both had mastectomies, we've both had chemotherapy,
mm.
radiotherapy, and now hormone treatment,
Yeah.
which is fun.
Fun. What a trip.
So fun.
What a trip. You think the diagnosis is enough. You think, okay, that's one thing. Okay, get it out, chop it out of me. I don't care. Just get rid of it. I want to be so far away from it. But then it's like treatment, they call it the active treatment. So you do the
Mm,
radiotherapy, chemotherapy. Okay, I've done the worst bits. But then, I mean, there's so much to be said for life after cancer.
mm,
That's another, you could do a whole, series of videos on life after
yeah,
cancer for
yeah,
sure. I don't think I looked up. I think I just went from one appointment to the next,
yeah,
just kind of feet at the ground, and I think, I don't know, correct me if I'm wrong. I think processing for me, you spoke about processing, and sometimes, you and Steve made a decision, we need to get our heads around it before we start talking about it to people. Um, I don't think I actively decided what I was going to do. It was just, going ahead, appointment, appointment, appointment. And then if someone tried to talk to me, I wouldn't have processed enough. And I think for me, I struggled and did more processing, maybe 6 months, maybe a year after I finished active treatment.
yeah,
So it feels like I'm coming out of that period now. But yeah, very, very delayed in terms of, coming to terms with what actually happened. My body changed. Something happened that, yeah, my world turned upside down,
yeah,
basically. It's,
yeah,
it wasn't as I knew it. Um, and that it sounds such a cliche, but I just feel like a completely different person.
yeah,
Completely
yeah,
different person. It's
yeah.
weird.
No, I completely get that, and I understand what you're saying there because I think it's from diagnosis, like you say, your whole world is just tipped upside down, and it's almost like everything is revolving around this now. Like from
Mm,
one day, everything's
mm,
switched. And I hear you when you say you just got your head down and went through treatment because I was the same. I was sort of, let's just get through this. And I'm a reflective
yeah.
person anyway, so I tend to look back on things and deal with them rather than deal with them at the time that I'm going through them. And I
Mm,
remember when I was going through treatment, a lot of people said to me, it's actually after treatment that it all catches up with you. So once you've
mm,
finished with all the appointments, seeing all the doctors and the nurses, it's then that your head actually catches up with your body and processes
totally.
actually what's happened. And it's really important to have support there, I think, um,
Yeah.
when you're going through that stage. So I
Mm,
think you're about a year and a half sort of ahead of me in terms of, when we were going
mm,
through treatment and things like that. Um,
mm,
so, I mean, for me, it's been amazing to be able to talk to you and have open and honest conversations
yeah.
about your experiences. I can
Mm,
openly talk to you about anything that I'm feeling or thinking or experiencing, and
mm.
often laugh about all the side effects we're experiencing. But to be able to talk about it makes you think, oh, it's not just me, I'm not alone. And
Yeah,
yeah,
it's
like you
so
say,
valuable.
the hormone treatment, it puts you into clinical menopause. So we've both sort of fast
Yeah.
forwarded to that stage in life
Yeah.
and all of the yeah, all of the joys that brings as
Hmm.
well.
Exactly. Exactly. I had no idea when my pharmacist told me when I was given the prescriptions for these drugs that I was going to take for the next 5 years for my injection, 10 years for a pill, that he said to me, "Welcome to your old lady body." That's what he actually said to me. And he was a very cheeky pharmacist, and he always had a good sense of humor. So it wasn't in a mean way at all. And I was just like, yeah, yeah, I'm sure it'll be fine. I've done chemo. Like, come on, we could just throw the next thing at me. And now it's been 2 years, I think, yeah, it's been 2 years since I started hormone therapy. And he was totally right. I'm thinking about bone aches, joint aches, hormonal acne, hair fine differences, delicate stomach from the other tablets. It's just, I feel like I wake up every day and I just want to have a little moan about, oh, something else, my sleep, hot sweat. And you just think,
Yeah.
was it not enough? Have you not taken enough from me?
Yeah. Yeah.
um, but, you know, it works. This is the research, is my medical team looking after me. And I guess I've got to appreciate that I can take this treatment. I know this is another one of those differences we were talking about between the
Mhm.
triple positive, triple negative, or positive and negative diagnosis that you can get. For some people, it's not possible, with the hormone
Yeah.
treatment to come to help you for prevention, of your cancer coming back. Um, so in one way, you could say we're privileged that we get to have this medication. So it's yeah, it certainly makes me mindful of having that gratitude, that we're able to take medication to prevent our cancers coming back. And, I hope for a long time that that's going to be the case.
Yeah.
So,
Yeah. And I think it's
yeah.
quite key actually to look at it that way and to
Mm,
find something positive in it. Because whenever I'm getting down with all the side effects that we're dealing with, I always think,
mm,
but what's the alternative? I can
yeah,
live with mine at the moment is my eyes are watering all the time, like just constantly streaming. And it does drive me mad sometimes. But then I think, but I'd rather have this,
yeah,
than cancer coming back. And you just have to put it into perspective, don't you? And there's
yeah.
one like thing that I am quite grateful for in terms of, since my diagnosis, and it's, we all know it's really crappy. It's nobody wants it. Nobody wants to have to live with it. But at the same time, I'm like, it's like you were saying, it's changed you as a person. And for
Mm,
me, it's given me this confidence that I've never had before to go out and to try things and not be afraid to get things wrong or make mistakes. And that's one thing that I'm really grateful for um, is that it's just given me this different view and appreciation actually of what I've got. And yeah,
Yeah.
cliche, but yeah, just living in the
It's
moment.
true though. Exactly. I mean, that was the main thing that, we were talking about what have, what can we take from this? And yeah, I have I would say life before cancer, my previous life, that I was more anxious and always thinking about the what ifs. And that's not gone away completely, but having this experience has definitely shown me that to be present, to be grateful for what's in front of you. And like you said, I know it sounds like a cliche, and it is so difficult. Sometimes those pains, those side effects, those symptoms, those thoughts, they're really hard to get a hold on. But when you realize that with practice that you can, and it brings you into the present, it is so valuable. It is so worthwhile. And that is something that I wouldn't have worked as hard if it hadn't been for cancer.
Yeah.
This is my family's life, my life. I want to be here for the kids. I need to be here for the kids to not think about what if, and it's blooming hard work. It really is. Life still rolls on,
Yeah.
and you can be stuck worrying about whatever, but the kids in front of you are saying, I'm hungry, I want dinner, or can you help me with my homework, please, or can you take me to football? Life rolls on,
Daily life doesn't
and
stop, does it?
no, no, it doesn't. So
But it gives you a
there we
strength
go.
that you just never knew that you possessed, doesn't it?
Yeah,
Thank you
absolutely.
so much, Leanne. It's been great chatting to you.
Thank
I feel like we
you.
could do like hours just on side effects,
Yeah, I was like, this is the
menopause.
intro, right?
Oh, it's
No,
been
yeah, let's
brilliant.
do this
Thank you for
again.
sharing all of that. It's been
Thank
great.
you.
Um, and yeah, I'll catch up with you soon.
Yeah, see you
Take
soon.
care. Bye.